Hi, welcome back to Colorado and Company. Your face is the first physical feature that people notice about you. And due to the delicate nature of the facial skin, it's also one of the first areas to show signs of aging. The Center for Aesthetic Facial Surgery was founded by Dr. Michael Menikoff, the recipient of America's Top Physicians Award for Facial Plastic Surgery for the years 2003 through 2009. He was also named one of the top doctors in the global directory of Who's Who for 2009 and was featured in United Airlines Sky Concierge magazine as one of the best of the best. Dr. Michael Menikoff joins us this morning. How are you?
I'm good. How are you, Denise?
Good. Congratulations. That's pretty cool with all those awards.
Thank you.
Now, last time you were on the show, we talked about you have a whole new design, a variety of procedures that are specifically for people who need to return to work more quickly, which is fabulous because a lot of people are like, I'd love to do this, but I can't take a month off of work. So tell me more about that.
Well, and that's exactly right. You know, this business has changed so much since I first started 20 years ago. It used to be that, you know, the typical patient was someone who was very rich, who could take a couple months off from work, had people who would take care of them. And then when they came back after a couple of months, they would have a big party they'd throw for themselves, and people could come and look at them, almost like they bought a piece of art or a new car that people would come and admire. And, of course, that's really not what things are like now. Most of my patients now, they work hard, they set their money aside, they've got a week maybe to take off to have something done. They want it to look good, they want it to look healthy, but it's got to look natural and normal. They don't want people looking at them afterwards, wondering who their surgeon is. They want people looking at them and saying, wow, you look great, and not even thinking that they had surgery. And
yeah, they don't want to throw a party for themselves.
No, they definitely don't want to throw a party for themselves. So we've designed a whole variety of procedures now that really accomplish that get them to look young, healthy, active, vibrant. No one would guess they had surgery, and usually they're back to work within a week.
And one of those procedures is called the Quick Lift?
Quick Lift is my version of a mini lift, a mini facelift. It's a 2-hour facelift. You can see here on the before picture for this gal, she just felt like she was a little bit heavy to the bottom part of her face, some wrinkling to her skin, a little sagging in her neck. Yeah. This was a 2-hour procedure. A week later with some makeup, you can see she still looks like her, looks healthy, looks young, looks youthful. No one would guess she had surgery, but a really nice result for her.
She looks rejuvenated. She
really
doesn't look like she's had anything done except she's had rest and healthy.
Exactly. Mm-hmm. And, you know, it's funny because she, along with others, they'll come back and they'll say, you know, it's 2 months after surgery, and people look at her and they know she looks good, but no one's ever said anything. Never even guessed that happened.
It's a good doctor. That's what it is. And a lot of people would think that procedure is for older people only, but it's for younger also.
Absolutely. And that's the other thing that's changed dramatically. You know, 15 years ago, my average patient was probably 60, 65 years old, and now my average patient is much younger. I see a lot of women and men in their 40s and 50s. And it's a very different kind of procedure, though, in those people. And somebody in their 60s or 70s, yes, it's a really nice result and makes a big difference. And you can look at the before and after pictures and point to say, yes, the jowl is a lot better here to here, and the neck's a lot better here to here. In younger people, it's a different operation. This is a young, healthy, very active, very vibrant young gal who just felt when she looked in the mirror that she looked a little older than she felt. And you can see from the before pictures that we ran by just a second ago, really wasn't bad, few little things. But when you look at the before and after pictures, what you see is not so much that the jowl is a lot better or the neck is a lot better. It's just an overall more youthful look. Yeah. And that makes sense because they are younger. You take care of the few visible signs of aging that are there in a young person. And the overall effect is a very, very youthful one.
Wow. She not only has a great profile, but straight on now, too. You can see a difference, but that's because you told me there's a difference. Otherwise, it's natural.
Right. And so none of her friends, nobody guessed that she had surgery, yet made a really big difference, again, when you look at the before and after pictures with that. So it's a nice option. And, again, younger and younger people are doing this because, you know, what they say, the 40 is, you know, the old 60, and it keeps getting so.
And, Doctor, there have been times where people come to you and they go through the consultation and then realize, okay, maybe I'm not ready yet. What do you do in that position?
Well, we have a lot of really nice options for that now as well. Sometimes people come in and they just don't have enough aging changes to warrant doing anything surgically yet. Some people come in and they do have some aging changes that would warrant surgery, but they really don't want to have surgery, or maybe they don't have any downtime available. And so there's some very nice options that can make a really nice difference. A couple of things, the most common things that we do would be injectables. Botox and Dysport are two, and then Juvederm and Restylane. This is a nice picture with Botox. And again, young gal, didn't like the wrinkles in between her eyes. Another example, an older gal, same thing. It's the wrinkles in between her eyes, felt like it made her a little angry, had some Botox. This is a week later. Literally, this is a 2 or 3 minute procedure, no downtime at all. And makes a nice difference in the overall effect. It's funny, for Botox, my toughest patients are my teachers, because they come in, they don't like the wrinkles between their eyes, but they're afraid if I make them expressionless that they won't be able to let their students know, their kids know, that they're really upset with them and get their attention. And again, as Botox, just like anything else, you can overdo it. You've got to be careful. There's that great, really funny commercial with Joan Rivers where she's trying to, she's asking the person whether she's moving her face or not, and doesn't know. And so you need to use it judiciously. You want to relax the muscles, you want to soften those wrinkles, but it has to look natural. You have to be able to express yourself naturally, and you certainly can.
And that's where a good doctor comes into play, like Dr. Menenkoff, 303-792-3838. And you also offer, which is really, really cool, computer imaging, so they can see ahead of time what they're going to look like or close to it.
Right, absolutely. And, it's one of those things that it makes me wonder sometimes why everybody doesn't do this. I know the issue that, the salesmen for the company come into the office and they really present it as a sales tool, but that's not what this is at all. It's really a communication tool. To be able to sit down with somebody, have them explain to me what they want to look like when they're done. For me then to put them on their face on the computer, make the changes on the computer so they can see what it is that we're talking about. Sometimes they'll look at it and say, you know what, that's not quite what I want, in which case we can change it until we get it just the way that they want. Then I know, number one, is it really something that I can do? Right. And if it is something that I can do, what do I need to do technically in order to get them there? So it's a great communication tool in both ways.
Huge advantage, yeah.
It works really, really nicely.
Doctor, you mentioned Botox, but you also offer Restylane.
We do.
Okay, tell me more about that procedure.
You bet. Restylane and Juvederm are the two hyaluronic acid fillers. Hyaluronic acid is a substance we have in our own skin. These are chemically identical to that. These are fillers. You inject them underneath the skin. They lift the skin. They add volume. A great example here, you can see for the nasolabial folds, the folds that go from the corner of the nose to the mouth. These are younger women that really didn't need a surgical procedure. A little bit of Juvederm into those folds, and you really can see how it softened the folds, took away the little bit of heaviness and fullness that was there, and made them look more youthful without doing any surgery. This also, again, this is you're in the office for maybe half an hour. It's a 10-minute procedure. The results are immediate. They put makeup on. They're back to work right away. No downtime at all. It makes a really nice difference.
Yeah, big difference there. Now, these non-surgical procedures that you can do, can they also be used in conjunction with surgical procedures?
They sure can, and that's the other thing that we've kind of figured out as well. I'm a surgeon. I like to operate, and I tend to think about things in a surgical way. But you move things around underneath, like in the 2-hour facelift that we talked about earlier, that you give the face a nice, young, overall look, but if the skin over the top of that doesn't look young, then it still is a little bit of a giveaway, and it doesn't look as good as it could. So there's a whole variety of things, both Botox and Juvederm, as we talked about, but also a variety of other things, some medium-strength lasers, intense pulse light therapy, microdermabrasions, chemical peels. These are things with either no downtime or very, very limited downtime that can be done in the office that improve the quality of the skin. They tighten the skin, they take away brown spots, take away broken capillaries, and really give the skin a nice, even, smooth complexion. You do that to the skin of a person who's had one of these 2-hour facelifts, and the whole package looks terrific.
So many advantages, including that computer imaging. It's just a wonderful technology. Thank you for coming on the show.
Thank you.
Again, the advances in facial plastic surgery eliminates the lengthy downtime and gives you that natural look. You, only better. Call the Center for Aesthetic Facial Surgery to schedule your complimentary initial consultation and free photo imaging. Free photo imaging. The number 303-792-3838, and take advantage of the additional special offers exclusively for our Colorado and Company viewers. 10% discount on all cosmetic surgery procedures, $100 off per syringe of any Juvederm or Restylane treatment, and only $10 per unit for any Botox treatment. Those are some great specials. All procedures must be booked and completed by the end of March 2010. That number again, 303-792-3838. You can learn much, much more online about Dr. Michael Menenkoff at thefaceexperts.com. The website, one more time, is thefaceexperts.com, and the Center for Aesthetic Facial Surgery paid for this segment.